So I feel like I've got somebody, ooh, and I hate to say this, but I'm going to say that because this seems so cliche and I haven't had one yet. It feels like it probably was COVID related because I have a lot of chest related issues going on. I feel a lot of pressure right straight down the middle of my lungs, and I feel like my lungs have pressure. This particular individual feels like I get this impression of I'm going along in life and everything is fine. And then boom. And then it's just like, I'm just not here anymore. So it happened very quickly. It happened very rapidly. I also feel like this person was younger. So this would not be your typical person of like 70s and 80s with other comorbidity issues. This person feels to me like they would have been basically probably pretty healthy. And then all of a sudden, this comes as this really big surprise. I've got all this stuff going on right in here. And then the next thing you know, bing, bang, boom, I'm just not here. So again, getting that feeling of this person being younger. I'm trying to get an age because I don't hear a number, right? But I want to go somewhere like between 40s and 50s, with bearing in mind plus or 5 years on that, because it's a feeling I have about that particular energy. Ended up in the hospital. There's a lot of arguments about what's going on, how things need to be happening. There's family related to this individual. This is male, by the way. I'm so sorry. I should have said that. This is a male because I'm trying to process everything. So I forget to say so sometimes. There's a huge medical connection to this person too. I get the sense of he was either in the medical field or around medical particular type of work. So he was in and or around hospitals, not just because he was ill, but because of either something with his profession or somehow he was tied to that community as well. So he gives me the feel of a profession wise, he would have been in or around and involved with the medical community in some way. He was very active when he was alive too. So I think that was part of the shock of the passing, because again, feeling very healthy, feeling like I'm somebody who's go, go, go. Would have been, again, I'm getting that feel of being connected to either the trauma or like medical trauma unit or something there. He took all the necessary precautions, he says. Didn't feel like he was even getting sick or anything was wrong. He felt okay. Getting the sense of not regretting any decisions or any of the choices that he made. He was where he needed to be, doing the things he needed to do. Gosh, I don't know if this is a doctor or what, but that's really kind of the feel I get for it. Have you been having a lot of fear and panic regarding COVID? Just yes or no?
Yes.
Okay. Because I'm getting messages from him now, which are about how to feel about COVID. And I'm going, I wonder if this is going to matter to you and how you're feeling about it, because he's now kind of starting to talk to me about, so maybe he's going to be what I call a pop-in. We may never be able to identify him. I don't know. He's just going to give some messages. You can take it or leave it because you can't identify him. I get that. It's hard for me too sometimes. Again, I get that feel of him being in the thick of things, being around all of these people that weren't well. And there was a part of him that said, yeah, he was concerned for himself, but he really wasn't afraid. He had a job to do. He got in, he did it. And he wanted to be there. He wanted to help other people. He always knew that no matter what he was doing by helping other people, he kind of like, look, I was always at risk, whether it was from COVID or something else. You always run that risk of catching something from patients and critical people that you're helping. Says, I wouldn't have changed a thing because I was doing what I needed to do. He's really sad though. I mean, I've got this very emotional heaviness, this sadness going on about me. That he hates to see the way that people have moved forward. He's talking about a lot of clinical workers are now very afraid to give their patients the care that they want and need. I've never heard that before, only from him. So I'm just telling you his point of view. because they're so afraid now that they're kind of almost withdrawing and not giving the care and the compassion that they need to be giving to their patients because they're so frightened for themselves. So there's a part of him that makes him sad for the patients, but it's also there's this sense of anger that this type of fear has been put out to get people to do things. He calls it very manipulative, very maniacal is the other word he's kind of using, or that comes up for me. That angers him because he says the threat has been real. And he talks about there are people who really need these things, but because so much of the fear has been going on, it's affecting people. He shows me both sides of the fence, right? There's all these clinical practitioners over here who are terrified and in these positions, not only for their life, but their jobs and where they are. But then he talks about the patients over here, and he keeps talking about the lack of compassion, the lack of care, the lack of connection. He goes, we used to be a community that connected with our patients, and we really aren't doing that anymore because of this sense of fear that we have that we're going to contract something. And he's talking about we're not doing the right things. We're not doing what's necessary to talking about the learning curve for being able to deal with this. Does that make sense? Does his messages have any value or significance to you?
It does.
Okay. And I think too, if I just kind of honor what he's saying is that it's like, if he could wish anybody anything, it's about the reduction of the anxiety. He says he goes, people's anxiety and fear levels. He goes from where I am now, right on the other side. He goes, I have this huge fear myself that people are going to get sicker and sicker because of the fear, because of the stress, because they're driving their bodies to this state, to this emotional state he's talking about, where they're so intense and they're so upset that it's honestly making them sicker than anything else that they could be doing. And so he says there's this emotional sense that we need to relax and calm down. He talks about we need to be objective here and realize, yes, there's a very real circumstance that's taking place in life, in society right now. The medical community is doing the best that it can to care and treat for people based on what we know. And he goes, but don't forget, we're sidelined by the same people that you're sidelined by. And he gives me that feel kind of like a big pharma and politics. And he goes, we're trying to suss out the truth as well. He goes, remember, we're human too, right? Medical workers, him as a doctor, we're human too. We have to make these judgments about our patients and ourselves and what we're hearing. And he goes, it was really hard for him sometimes to know right from wrong. Oh, gosh. And he said, in the moment, we had to make critical decisions based on our gut feelings because we didn't know the truth either. Said we only knew what was in front of us, what we felt we needed to do. And he said, that was my duty. That was my purpose. That was my calling. And I did it the best that I could because I wouldn't take anything back. He said, so don't undermine the medical community is what he's saying. He goes, the people I knew were doing the best they could to get by based on the limited resources and or knowledge that they had as well, because they were just as tainted by things and their personal struggles. He gives me the impression of being a very ethical man, of being someone who wanted to do the right thing in the moment and really looked at it and said, this was my patient and that's where I made my decisions. I didn't try to make it from politics, from anything else other than what does this person need in this moment? How can I make the best decisions based on what I know today? And he also says, lots of blame, lots of criticism for medical professionals. He goes that he doesn't feel as well deserved, but he understands it, right? He says, okay, I'm up here, I see it. He goes, I understand why people are making these decisions and judgments. He goes, but we're people too. We're people too. And this has been difficult for everyone. And to just respect that as much as we possibly can. He also now switches a little bit and he talks about personal health. And he's bringing up the soda scenario, which is so funny because I was making a comment a couple of yesterday and today about sodas. And he goes, it's just horrible how people are polluting their bodies with a lot of different toxic things that we pull into our system, right? You know, we know that soda is one of them, but other foods. And he goes, people are so worried about this over here, this, what we're going to call this the virus, right? I hate to use that word, but that's what it is. And he goes, but they're not looking at all of these other things that are making their body toxic. And he goes, these things compound each other. He goes, if we take all of these toxins that we're putting in our body from over here, from normal, everyday, daily living, and then we come over here and we add the viral load on top of it, is the word I'm hearing. He kind of shows me this big, it looks like this. There's this big body of stuff that we've already put into our system, right? He also talks about stress and hate as a part of this. It's not just what we ingest as far as food and toxins and what we put on our body. He talks about the emotional stuff that we put in, all of that plays together. And then he says, and then what happens is we get this virus up here and it becomes too much because of all of this that was going on. So this basically kind of becomes and now he's showing me a needle popping a balloon. He says the balloon was already there, right? The virus became the needle. And then he shows kind of that goes in. And then what happens? The air leaks out. So he's talking about, he still wants to help people. Gosh, I wish we knew who this was, but if the message has value, I'm going to take it because it means something to me too. Be concerned with the balloon, right? He says, make that balloon so that you don't have all that toxin in there. And again, that comes from all of these different things that we're doing and putting into our body. But again, the mental stuff, the thoughts, the emotions. He talks about, I didn't really give emotions as much credit as he's giving it now from the side of spirit. He goes, I didn't realize how much the emotions trigger different chemical reactions in the body, is what he's saying. So when we get control of the emotions, I think it's kind of what he's trying to convey here. Keeping ourselves calm, being faithful, he said, being hopeful, not moving into that state of anger, agitation, or confusion even, because I feel like you've been really confused. I kind of get this sense of you back and forth, back and forth, back and forth, bing, bong, bing, bong, bing. Does that make sense? Yeah. And so it's like here. He says that's so disruptive for the body. He goes, that sets up that state for these other things to kind of come in and invade, and your body isn't as resilient as it needs to be. So he's talking about taking all of these techniques and combining them, and he considers that a medical treatment from spirit. He's talking about this is a medical treatment. He goes, manage your emotions, manage your symptoms, manage your toxicity levels is the word that I want to use with that. And recognize that it is a complete holistic picture. He's now talking about as a doctor and whatever this critical stuff that he did. My job wasn't to handle all of that. My job by the time people got to me was sometimes it was too late. They were already in emotional distress, physical distress. There was already a lot of different things that were going on. So by the time I got to them, there was this cascade of events. He goes, I couldn't stop that. He goes, I could only try to mitigate what was happening in that moment. So he goes, as I can give you the message today, mitigate what you can now with whatever he talks about, with whatever strategies you have to fight off that, I'm going to call that disease, right? That virus. Gosh, I hate to go there, but that's the message for today, I guess. Realize you have a lot of things at your disposal that will already help you. Eat right, sleep, stop stressing, stop believing everything you hear. Make those decisions for what feels right for yourself. He goes, because he's talking about, I'm not getting into the politics of any of this. That's not why I'm here. He says, I'm here to help people heal. I'm here as a doctor. I can see things differently from my perspective. I want people to manage their emotions, take responsibility for what they're putting into their body, and realize by the time you're getting to me, there's probably only so much I can do. And he's talking about you are the one that has control, meaning us, right? Right. Us here. We're the ones that have control over whether we get to that point. So look at this holistic approach for health. And please stop being afraid. Just stop being afraid. And he's just so emotional about that. He says, if I could get anybody to do anything, it's to stop being afraid. It's so damaging to the body on so many different levels. He goes, and ultimately he's saying, he's going, what's it doing for you anyway? What is your fear doing for you? He says it serves nothing. It doesn't change the situation. It doesn't change what you believe. It doesn't change what you think. He says the only thing he's talking about is this biochemical response in your body that you're in fear mode. And he goes, it's taking all your rationale and your ability to resist anything away. He's now kind of expressing that being courageous, being in a loving space. He is saying he sees an end to this. He goes, it will peter off. We will find better cures, better treatments. Things will move on. He goes, there is light at the end of the tunnel. He goes, we're still in that learning curve right now. We're still finding those answers. We're still discovering truths about ourselves. He also showing me this humanity. Like this has lessons for humanity as well. He talks about opening people's eyes, not just to the bigger political picture, because again, he doesn't want to go there, but he's talking about accountability of the self, right? He's talking about it's making people more aware of the choices that they're making. And he says, I'm happy to see that. There was nothing more frustrating, he says to me, as a doctor, than seeing people come into my office and me understanding why they weren't well, but they weren't doing anything about it. They wanted me to fix it. And I knew that it was something they had to fix themselves because they were making either bad choices or wrong decisions, or they weren't willing to step up and make those decisions. He goes, there's only so much I can do to heal someone. He says, you must heal yourself. And I and other medical professionals will be there to support you, but we cannot do it on our own. Meaning the medical profession, that person, the doctor, they can't be the one that fixes it for you. You must take that leap of faith to fix yourself. And that has to come with courage and hope and love. And he talks about this willingness and dedication to fixing the self in whatever possible way that you can. Everything dies off at that point, and I feel like he's now telling me, thank you for allowing me to come through and to allow me to share my perspective and my point of view on things. He feels like that will be helpful and hopeful to you at some level, but he also hopes that that will be hopeful and helpful to others as well, and even for me. Boom.